Hi everybody, my name is Zen and I am a licensed acupuncturist, herbalist, and founder at Healing with Zen, and I wanted to answer a couple of the most common questions asked about pediatrics and acupuncture. Can kids get acupuncture? The answer is yes. Kids actually respond really well to acupuncture, and many times kids actually really like it. Adults usually feel like needles might be scary for kids, but in actuality, I've treated a lot of kids who responded really well and actually really liked it. We use really fine needles on kids, and most of the times if I'm treating infants, toddlers, or younger kids, I don't leave the needles in the body. It's different from doing acupuncture with adults. Usually what I would do is put the needle in and out right away. So the treatments are much shorter, but still very effective because kids' bodies respond really well to acupuncture. There's also a wide array of modalities that I use to treat kids. So we don't just use acupuncture needles. In case they are scared or a little bit wary, I can use something called microcurrent. So instead of using needles, I would use a little bit of electric current and stimulate points that way. We just hold it against the skin like this. We can also use ear seeds, which are little tiny pellets on a sticker. And I like to use these to show parents where the acupressure points are so that parents can go home and continue to massage and create stimulation in those points at home for the kid. This is really good for digestive issues, immune system boosting, calming the kids down with any kind of stress or anxiety, ADHD type situations. We could also do gentle cupping. We could do acupressure massage. A lot of times I will massage certain parts and meridians on the child's body when they're in the office. Sometimes I'll prescribe herbs or supplements and vitamins for the kids. And a lot of times it comes down to talking to the parents about diet and lifestyle. What age group of kids can get acupuncture? Acupuncture can be administered on all ages. I have worked on infants and babies, and with these children, it's just a matter of pricking the skin in and out, and that's it. We don't leave needles in. Baby's not laying there the whole time. It's really quick, and with the help of the parents who are next to them, it usually goes by really fast, and babies respond really well. All kids of any age group can get acupuncture. And like I said, there's a lot of different modalities that I use to treat kids of all ages and health conditions. Does my child need to have something wrong with them to get acupuncture? The answer is no. Acupuncture is so good as a preventative medicine. A lot of patients will come in just to boost the immune system if they know they're going to be traveling or if the kid is going to start school soon. It's good to boost the body's immune system so you're able to be around a lot of other kids and not get sick. And if you do get sick, recover quicker. What conditions can acupuncture and Chinese medicine treat? Well, kids get sick just like adults do. The most common things that kids get acupuncture and Chinese medicine for is respiratory issues. So common colds, sinus congestions, allergies are really common. I see a lot of eczema and skin conditions, digestive issues, so, discomfort with eating, constipation, or diarrhea. Acupuncture works really fast and can help really quickly for those kind of issues. Also, things like headaches or any kind of body discomforts can be eased with acupuncture. And a lot of times people don't realize that acupuncture can help with a lot of mental and emotional issues as well. So kids dealing with anxiety or ADHD, or if they're depressed or not themselves, sometimes acupuncture can really help make them feel better and happier and more balanced. What happens during the initial acupuncture treatment? Well, I actually like to do a long intake with the caretakers. We go over health history, the conditions, what's going on with the kid. Sometimes I'll ask about diet, lifestyle, all that stuff, just so that I know I have a good foundation of where we're starting. And then from that point on, I assess what the patient needs that day, what type of treatment, and we may do some acupressure, some acupuncture, maybe give some ear seeds or some advice about diet, and maybe other things during our time together. The initial session is 90 minutes, and future sessions last about 30 to 45 minutes for kids. How many treatments will my kid need? Well, that really depends on what type of issue we are treating and the severity and duration of the illness. For acute issues like common cold, maybe 1 to 3 treatments. If there's something more chronic like asthma or allergies, we're looking at maybe 6 to 8 treatments to get the full results. These treatments are usually spaced 1 to 2 times a week in the beginning, and then we start spacing them out as the patient gets better. So each case is different, and we can only assess how many treatments are needed during the initial treatment and the follow-up. Are siblings allowed in the treatment room? It depends on the age of the sibling. If it's a baby that's accompanying the mom, then of course the baby can be in the room. If it's an older sibling, I usually ask the older sibling to wait outside in the waiting room with toys or books or whatnot, just because we want to give the patient sufficient individualized attention and time. And we want to prevent any kind of distractions for the healing to take place. I do acupuncture on my kids, and you can see them in the pictures here, and they love it and they respond really well to acupuncture. I do have other videos of how I treat kids using acupuncture and Chinese medicine, so be sure to check that out on our website or our YouTube channel. If you have any other questions, please reach out and let us know. I'm happy to do a video chat to discuss your situation and to see if we are a good fit. So feel free to call our office, 626-377-9596. You can email us at info@healingwithzen.com or visit our website, healingwithzen.com. I hope this was helpful, and I look forward to meeting you and your kiddos soon.